Discover the latest health tips, expert advice, and inspiring stories. This is the Health Channel Podcast. Your journey to better health starts now.
How many times have you played tennis and wondered if you pulled a muscle? Or woke up in the morning thinking I slept on the wrong side and that's probably why I'm suffering? Not being schooled in medical arts, nowadays it's common to look to the internet and to try to self-diagnose. And oftentimes, whether you're a doctor or not, it is common to make a mistake and to have a wrong diagnosis. Today, we are going to talk about some of the most common misdiagnoses in spinal care, as well as answer your questions on this episode of Ask the Doc. Welcome to Ask the Doc, a show where we encourage our viewers to send in their health questions. I'm Dr. Georgiy Brusovanik, a minimally invasive spine surgeon, and let's start things off with a question from our Facebook page. This one is from Charlie. Hey doc, I was helping my brother Matt move into a new place and just like that, my back went out. I think it's just a muscle pull, but my accountant brother thinks it could be a herniated disc. What do you think? Charlie, that's a really good question. I think that's a very common question that I hear from patients. You don't have to have sciatica and while having a herniated disc. In fact, it's very common that a pulled muscle and a herniated disc will elicit the same kind of midline back pain or back pain off to the side. It can all produce this weird curved appearance where you look like you have suddenly developed scoliosis. The truth is, the best way to know is with a little bit of time. A muscle pull from lifting something incorrectly should get better within a day or two, whereas a disc-related pain that's related to a herniated disc, that will produce pain in all positions. It will continue to hurt despite a few days of rest. In fact, it may even get worse. One thing that I may advise you on is consider if you can lift your leg with your knee straight, then probably it's not a herniated disc if that doesn't elicit further pain. That's probably a sprained muscle. Look, in the end, it's always a good idea to see a doc if you're not getting better within a reasonable amount of time. So if you're suffering, that's probably the best answer to your question. Let professionals decide if you're still suffering. Thank you for this question, Charlie. And I'm sorry to hear that you are suffering. Our next question comes from Reggie, who reached out to us on our YouTube page. I'm so sorry, Maureen. Dr. Brusovanik, my personal physician originally thought I had fibromyalgia and prescribed duloxetine as well as exercise. Unfortunately, my back pain got worse, so I went to an orthopedist who diagnosed me with ankylosing spondylitis. Are these diagnoses similar? Maureen, ankylosing spondylitis is a very serious diagnosis where we are starting to see patients lose flexibility and sort of walk in a forward flexed posture, but we see the same appearance with degenerative discs. So just because you wake up in a forward flexed posture or you have a difficult time standing up, it's probably not ankylosing spondylitis for the general public. Now, being misdiagnosed with fibromyalgia is something that really touches a note with me. I have gone out onto media discussing the fact that I believe that fibromyalgia is not a legitimate diagnosis. I think that most of the time, patients who've been deemed to have fibromyalgia actually have something else. And most of the time, it's something else related to a cervical degenerative disc. There are no outcomes measure for fibromyalgia. There are no tests we can order to measure the severity. There are no medicines that make a difference. And the natural course of the disorder doesn't seem to be affected by any medicines you take. Now, when I talk about this, online, on social media, in the news, a lot of patients will then message me saying that I'm being heartless in saying that it's not a real diagnosis, but it's completely the opposite. I see these young moms contact me from all over the world saying they have been told it's fibromyalgia and there's nothing you can do, when in reality, if it is something like ankylosing spondylitis, as in your case, Maureen, or if it's something that's like a garden variety degenerative disc, then it's something fixable. And it would behoove me to carry the message that you shouldn't suffer. You just need a second opinion, and most likely a neck MRI. So I would say if you have a blood work laboratory result showing something called HLA-B27 in your blood as being positive, then Maureen, you may indeed have ankylosing spondylitis. But unless you've had that rare lab work done, chances are look to obtain a neck MRI. And to those who are suffering for years and years after being told that you have fibromyalgia, please don't hesitate. Ask for a neck MRI, especially if your symptoms include things like headaches, shoulder pain, shoulder blade pain, neck pain, facial tingling, jaw pain, and generally upper extremity tingling, numbness, or weakness. Thank you for this really difficult and great question, Maureen. It's a very common problem. I appreciate you coming out and saying this to us. And for those of you who are wondering how you can send in your questions, which we really appreciate, these questions definitely touch a lot of our viewers because the common problems are common. Please don't hesitate and check out our social media page, YouTube and Facebook, Instagram, as well as our website, which is chock full of information. The next question comes from Reggie. Reggie reached out. Thank you for that. Hi, Dr. B. I'm a middle-aged man who played a lot of sports growing up. I started experiencing hip pain about 4 months ago and figured it just comes with the territory and I'll tough it out. But it's gotten worse and I'm not sure if I should go to my PCP or see an orthopedic surgeon. It's probably my hip joint, right? Reggie, that's a great question. So many patients will come in saying, I have hip pain. And just as you are asking, what is your hip? Is it a hip joint? Is it the muscles about the hip, which is another problem? Or is it your spine, which can cause both referred pain as well as nerve pain to the same area? In Spanish, patients will refer to the whole area as la cadera, or in English, we just say the hip. But it can really mean different things to different people. So to break it down, and the answer should be, you should go see your PCP, of course. But just to give you some helpful hints, if you can put your finger right on the outside of your hip, touch it and say, that's the point of my maximal pain. And when I touch it, it's worse. And when I lay on my side, it's horrible. That may be trochanteric bursitis, or the pain around the hip from the soft tissues. If you get in and out of the car, and to do that, you like to grab your leg by the pants and literally help the leg in and out. And if your pain gets worse when you walk, and if you have groin pain, the probability is extremely high. It's the actual hip joint that's bothering you. And if you compound that with a good physical exam where a doctor can tell you with a high level of certainty whether it's the hip joint, you can achieve a 99% assuredness that it's the hip joint even before you obtain proper x-ray. The hip-related pain that's actually coming from the spine presents differently. It's worse when you sit. It can be worse with walking. And oftentimes it's associated with back pain and pain going below the knee. I don't want to confuse you. And Reggie, it's such an important question. So it's hard to skip all these details. But I'll tell you again, definitely go see your doc and see if you can get a proper diagnosis. Thank you, Reggie. Maria Cristina sent this question via our very own website, allhealthtv.com. You should really check out that page. So Maria Cristina asks, hi, Dr. Brusovanik, I've been having pain in my backside. I slipped during a recent rainstorm and fell square on my arm. Okay, this is embarrassing, but my butt hurts. But that's not the most embarrassing part. Maria Cristina says, I kind of had hemorrhoids before I fell, so now I can't tell if I hurt my tailbone or if it's still the hemorrhoids. Is that crazy? Not at all. Maria Cristina, you ask a super common question. Having buttock pain, coccyx, sacrum pain, even pain that radiates to the vagina, to the anus, is super common. And again, with everything else, as with everything else, you gotta have a diagnosis. You gotta know where the pain is coming from. Otherwise, there's no chance to help it get better. Now, the good news is that most pain gets better on its own. But if you've been struggling for a while, then there are a couple of maybe intelligent points I can make. Number one, when you fall, it's rare to break your sacrum or your coccyx. It's protected by a lot of soft tissues. And in general, if you fall onto your butt, you will hurt the ischium, which is sort of your sits bone on either side of your buttock, as opposed to hurting the sacrum. Sacrum, coccyx have a very much variable anatomy. If you were to get an MRI, there's a very high chance that somebody will say, oh, it's a fracture. But I want to tell you that if you fall, the energy of the fall may go through the sacrum, but it may also go through the lower discs in your spine. And if you have a degenerative L5S1 disc, that may actually cause pain that you feel over your sacrum and coccyx. And these poor patients will fly in to see me for a second opinion with stories like they've had intraanal manipulations, they've had chiropractic therapy, physical therapy, without having a proper diagnosis, usually making them worse. Now look, to go back to your question, Maria Cristina, you could have hemorrhoids that may have gotten worse with a fall. And there's no way to tell over this, but let your doc examine you. And if he does not give you clear, objective diagnosis, please request an MRI of your lumbar spine. To anyone else out there, if you're having a hard time, get imaging, contact the show and we'll send you a prescription. There's no need to suffer in it. There's no need to suffer in this. Very low risk with an MRI. So if you're struggling with a diagnosis, you deserve a diagnosis. Thank you for this really great question, Maria Cristina. And again, it affects me very much because these are common misdiagnoses. I hear these stories all the time, patients suffering for years and years and years. Thank you so much for being brave and sending in this information. Alrighty, we've got another question. This one is on allhealthtv.com. This one is from Beverly. Hello, Dr. Brusovanik. I went to my GP about recently becoming diabetic and casually mentioned the tingling in my legs and feet. This was soon followed by a trip to an orthopedist regarding my lower back pain and brought up the tingling legs and feet with him as well. The GP said I might have diabetic neuropathy, and the ortho guy thinks I might have lumbar spinal stenosis. What do you think? Beverly, another great question. Thank you so much. I hear this all the time. Back pain, pain going down the legs, worse when I sit. I was told I have neuropathy. Nonsense, nonsense. Diabetic neuropathy does happen when your diabetes is out of control and it presents as numbness or tingling in an area that would be covered by a sock or a stocking. Toes could be involved, but these patients will rarely say it's the bottom of the foot only or top of the foot only, or even more rare, say it's my big toe only or it's the baby toes only. I'll see patients who have prediabetes, early diabetes, well-controlled diabetes, and they'll say, my pain has been written off as diabetic neuropathy. Look, it's important to keep your diabetes in check, but if your pain is worse when you sit, if you have tingling and pain when you walk, and you have back pain, chances are it's not diabetic neuropathy. Ask your doc to get a lumbar spine MRI. Look, a nerve conduction study or electromyography is an additional study that can sort of secondarily prove whether you have neuropathy or not, or whether it's pain coming from your spine. But that's a much less reliable study as just a proper evaluation by your physician and an MRI of your lumbar spine. Thank you again for this really brave question, Beverly. Okay, so the next question is from YouTube, and this is from Cecily. Thank you, Cecily. Dr. Brusovanik, I was in a car accident, and the doctor on call at the hospital thought I might have herniated disc or sciatica. Unfortunately for me, some of the symptoms of sciatica closely resemble those of a more serious condition known as cara equina syndrome. Hospital staff said I needed emergency surgery. Was that correct? Oof, Cecily, that's a very, very difficult question. So first, let me explain to the audience. Cara equina is where the entire spinal canal gets compressed. It can happen with a fracture. It can even happen with a herniated disc. And the presentation is severe pain, and half the patients will say numbness in their groin, literally numbness of their private parts. And some patients will say they have incontinence. So these patients will writhe in pain. They won't be able to find a comfortable position, and they have true neurological symptoms. These patients deserve an MRI. And if indeed they have cardiac equina syndrome, these patients deserve emergency surgery, usually a decompression if it's from a disc where the spine is just entered and little opening is created to create room for the nerves. For those where there's a fracture, you may have to fix the fracture and remove the fracture fragments. So it's very difficult for me to tell you from a distance whether you had cardiac equina, also because half the patients, according to the recent meta-analysis, actually don't have urinary symptoms. They will just say, I have difficulty walking, I have difficulty standing up straight. Look, if you have cardiac equina, you may have to act, and it's one of the rare situations where if you don't act, the incontinence can be permanent. It's one of those rare scenarios where if a doc says, we gotta operate, you may have to listen to your doc. That being said, it doesn't mean you have to operate within the next hour. It doesn't mean you have to operate within the next 2. It may mean that you have to operate within the next 24 hours. And if you've had this problem for 24 hours, you may have to rush. But I still want to urge you, try to get a second opinion. If the symptoms don't fit the pattern that I just described, severe pain, can't move, legs are numb, vagina, anus is numb, incontinence, if it doesn't fit that pattern, you deserve a second opinion. Cecily, I really hope that the operation saved you from this problem. And again, thank you for this brave question. To those of you that have these related questions, please don't hesitate. Your questions are very meaningful to us because so many of our viewers can say, I have the same problem. We have another question. This one is from Lenny. Dr. Brusovanik, I went to the hospital with a pinched nerve in the neck, which was causing serious pain and weakness of the arms. The young resident who examined me thought I might have cervical radiculopathy, but that wasn't the case, as I had an accompanying fever. The attending nurse got me tested, and sure enough, I had a spinal infection, and I ended up having surgery. Was that the right decision? Lenny, I'm really happy that your nurse caught this mistake and she made the right diagnosis. It's so good that she caught an infection, because a spinal infection can progress to cause spinal cord compression and even paralysis. If I was you, I would go back and give this nurse flowers and candy and thank her for saving you. Now, after the fact, to say whether you really needed the operation, it's very difficult. Usually, if there's an infection, a surgeon will take a sampling of the infection and send it to the pathologist for an evaluation. So you could request that information. In fact, the hospital, you deserve that information from the hospital. And that would be the best way to see what were the cultures like, what was the aspiration showing, which bacteria. And I'm really glad that your doc caught this mistake in time. I'm happy that you sent in this question. And our next spine-related question comes up from Daphne. Daphne reached out on Facebook. Shalom, doctor. My cousin Ruthie thought she was having severe back issues like degenerative disc disease because she was in severe pain. It turns out that she had pancreatitis. How is this possible? Isn't back pain always spinal in nature? Daphne, that's a common misdiagnosis. Look, structures that are sort of behind our belly, behind the intestines, behind the stomach, are described as retroperitoneal. And they include pancreas, the back of the stomach, your kidneys, and the aorta, which means that all these structures can also cause back pain. And look, I don't want to belabor the point. I think that it's inevitable that anybody with intelligence is going to look online and try to figure out what's wrong with them. Just be careful. It's easy to catastrophize when figuring out that a benign case of neck pain could be coming from a cancer, but it's also easy to avoid a serious problem by negating it and finding, assuming it's something sort of minor. So pancreatitis is a very serious problem, and it's really good, Daphne, that you guys were able to catch that. It just behooves the point. If you're suffering and it's been weeks and weeks, you gotta get an opinion from a doc, a nurse, a medical care specialist. If you're suffering, you don't need to suffer. What you need is a diagnosis. You need to know why you're suffering. And then you can really control the outcome in most cases. I really appreciate this question, Daphne. I guess it's an all health TV.com kind of a day. The next question comes to us from Vivian, who asks, Dr. Brusovanik, my husband Stanley is getting ready to go into surgery for degenerative disc disease. It's too bad he was originally misdiagnosed with a age-related disc degeneration. The past few years have been really tough on him. I guess my question is this: how can degenerative disc disease be confused with normal aging? Look, Vivian, all discs age. We're working on technology now, Stanford, Brown, independent researchers all over the world on how to slow down and reverse disc aging. I'm up to date on this, and there's nothing today that can reliably reverse disc aging. That being said, studies on patients who have degenerative discs but don't have pain show that when you're 80% of the patients will have discs that are degenerative, that are theoretically surgical candidates. These are patients who have no pain, meaning that they're not really surgical candidates. So degenerative discs become painful sometimes, and then we call it degenerative disc disease. If you're not suffering from aged collapsed discs, you just have normal age-related degeneration. But if you have pain, if you can't sit for too long, if the dinner is agonizing because you got to keep fidgeting, if you get up like an old man or woman, if you have difficulty standing for too long, that's degenerative disc disease. And if pain starts to go down the legs, as in sciatica, then you deserve treatment. Come to your doc. You don't have to suffer. For future shows, please don't hesitate. These patients are super important. I'm happy to hear you were able to get the correct diagnosis. We have one more question. This time, the question is from Malcolm. Hi, Dr. Brusovanik. How can you differentiate between focal shoulder blade pain, shoulder pain, and neck pain? Is it referred pain or something localized? Malcolm, I can dedicate an hour to this question because just like with hip pain, shoulder blade pain, neck pain deserve a diagnosis and are frequently confused. So I'll give you the basic, quick sort of sense. Neck pain going up to your head and pain deep behind, deep under the shoulder blade is disc-related pain. Jaw pain, face pain is also usually disc-related pain. Pain going down the arm, below the elbow, involving numbness of the hand or weakness of the hand or pain going down the hand, that's cervical disc disease. That's a problem with a disc excuse me, in your neck. Shoulder pain, pure shoulder that doesn't go below the elbow. Shoulder pain that's worse at night when you lay on your shoulder. That's worse when you reach overhead or reach behind in the car, or when you reach across. Difficulty, cleaning yourself in the bathroom or reaching to undo the bra strap in a girl. That's likely a tight shoulder, which is so often associated with a disc problem that it's oftentimes misdiagnosed. That deserves shoulder stretching. Nothing is going to supplant a physical exam. But if you're having pain with the trapezius, neck, headaches, and shoulder, you deserve a neck MRI plus possibly a shoulder MRI, not a label like fibromyalgia. You deserve a proper diagnosis. In general, patients who get diagnosed with fibromyalgia or shoulder pain simply needing therapy or neck pain simply needing therapy are very common. But if you are that patient and you are suffering despite therapy, despite all the chin tucks and all the shoulder pulls and all the rubber bands stretching, if you are still suffering, you deserve a diagnosis. You deserve a proper study like a neck MRI. And for those of you who have the undiagnosed hip pain, you deserve a lumbar spine and a hip MRI. Some of the questions that we heard today are such common questions. I was misdiagnosed with this or that, I continued to suffer, and now I'm getting a second opinion. That's a happy ending. And for those of you who are still in the position where your docs are saying, well, you just have to keep suffering, there's nothing I can do, that's all I've done, whether it's with surgery or without surgery, there's always a reason to have pain. There's always a reason. Nobody wants to have pain. So if you're suffering and you haven't had a diagnosis, then that's the next thing to look for, is to contact a proper doc, get a proper physical exam, have a doc who will listen to you and try to pinpoint the story correlated with the proper imaging and then provide you with a diagnosis. Then you can find the right treatment, the right therapy, and the right solution. Thank you so much for joining me once again on Ask the Doc. I'm excited to hear more of your questions, and I'm excited to talk to you again. Thank you again for tuning in, and see you next week.
Thank you for listening to the Health Channel podcast. We hope this information has been useful. However, please remember that only your doctor can advise you about what is best for you. Do not start, modify, or suspend treatment based on anything you have heard on this podcast. Please join us again soon.